Hi there. How are you? I wanted to come on this platform to introduce myself to you, our followers, and our potential followers, just so you can put a face to the name. I'm Dr. Taiwo Gynecology. I'm a gynecologist, and I practice in the South Suburban area of Chicago, specifically the Homewood, Flossmoor area. I've been an OBGYN for about 9 years now. I've been practicing OBGYN for about 9 years now, and I love women's health. My passion, my desire in life is to educate women about their health so that they can live healthier lives. I just want women to know. I want them to know stuff about themselves, about their bodies, so they can live healthier lives. I started my private practice January of 2022, and I'll tell you why I decided to go into private practice. I wanted the opportunity and ability to provide women with a comprehensive, diversified, and personalized healthcare plan. I wanted the freedom to provide that for the women that I take care of, and my private practice has allowed me to achieve that. Like I said, I want to educate women about their health. I want them to know things sooner, earlier, before it becomes a problem. The name of our practice, of my practice, is Dardur, and I wanted to share a little bit about how I came up with that. So my dad is a big inspiration to me. His first name is Dare, spelled like dare, and our last name is Durowade. And when he was in college, he got a nickname where they shortened his first name to Dar and his last name to Dur. And they combined it together, and he was being called Dardur everywhere. And so when I chose to begin my private practice, I was thinking of a name, and I just said, why not honor my dad and name it Dardur? So that's how we came up with the name. In my private practice, I've discovered a couple things, that there's some knowledge that's common knowledge to us, but it seems uncommon to the women that I take care of. So even the women in my life, I share a few things with them, and I'm like, why don't you know this? How don't you know this? You know, things that I think are common knowledge. So the goal of our page in the next few months and then over the next year and beyond is to share these common knowledge with our viewers and our followers. Just so, like I said, you know, and you're more informed. And when you go to your gynecologist or you come to see us, these are things you can expect. So before I go, I want to share a couple of things with you that if you go to your doctor for a checkup, these 5 things should be happening. And if they're not happening, you need to ask for it or come and see us. We'll do it for you. So the first thing is your history, your past history, your family history. Are there things that are hereditary that we need to be screening you for sooner? Are there hereditary cancers that we need to screen you for sooner? Do you need to see a genetic counselor? Do you need genetic testing? And these are things that insurances can cover as well. So these are things that should be happening. That conversation should be happening at your annual exam. The second thing is your breast health. Your breast health is more than just a referral to go get a mammogram done. A provider needs to feel your breasts. Make sure it feels normal. Let you know what your normal feels like, so that if something is abnormal, you can come back to the provider sooner and say, hey, this wasn't there the last time I saw you. So that's very important for the breast health. The third thing is your thyroid. Someone needs to be checking your thyroid. I had a patient come in for a routine check. We're just having, a normal conversation. And then I noticed that her neck was enlarged. And I asked her, have you noticed this? She said, oh yeah, it's been kind of getting big for a few years. Well, that's something we need to check out, right? Someone needs to be examined. It's not until something happens that we start checking your thyroid. Your thyroid should be examined at your annual visit every year. The fourth thing is your pelvic exam. Now, this is the part where everybody knows that a gynecologist does, right? So the pelvic exam is where we take a look inside the vagina. We make sure it looks normal. We test for STDs. We do your pap smear. Your pap smear is a test that we do as part of your pelvic exam. It screens for cervical cancer and allows us to intervene sooner before something becomes serious. The fifth thing, and this is, I feel it's one of the most important things, and why I would push for you to see a gynecologist rather than any other provider for your annual Well Women exam is a digital exam. When I tell my ladies, I call it an internal exam. So we put a finger in the vagina and a hand on the belly, and this is to feel the uterus, the size of the uterus, and if there are any masses in the ovaries. Just looking in and taking your pap test does not allow that provider to examine those particular organs. So it's important. That's how we discover fibroids. That's how we discover that someone has a mass in their ovary. You know, someone needs to be doing that part of your pelvic exam. So these, when you go to your gynecologist, if these things are not happening, ask for them or come and see us. We'll get them done for you. One last thing before we go. We're going to be rolling out these series called Common Knowledge, things I think are common knowledge but are really uncommon, people don't know. So make sure you stay tuned to our page. Our YouTube channel is Dardur Medical. We're Dardur Gynecology on Facebook and Instagram, and our website, dardurmedical.com. So make sure you subscribe to our YouTube channel and you follow us on Facebook and Instagram so you can be the first to know these important details. All right. Nice to meet you, and I look forward to seeing you.